Kerry Sanders reporting there. A closer look now at how the new CDC isolation guidelines are impacting two key industries. The organizations representing flight attendants and nurses say the new COVID recommendations put their workers at risk. Joining us now, Vice President of Nursing Programs for the American Nurses Association, Cheryl Peterson, and President of the Association of Flight Attendants, Sara Nelson. Thank you both for being with us. Cheryl, I'll begin with you. How specifically do these new guidelines about isolation put nurses at greater risk?
Yeah, thank you so much for having me, but I think one of our biggest challenges that we have is we really don't know. We have Omicron circulating now. Delta continues to circulate despite our best efforts to try and tamp down this pandemic. And we really just need to give people sufficient time to heal, to rest, and to get better before we start putting them either back to work, which is one of our big concerns about nurses, and that we are real clear that they are not going to continue to shed virus. I understand the 2 to 5 days, 2 days prior, 3 days after. I understand that that is where we think the science is, but it's not 100%.
So, Cheryl, is part of the concern that nurses will be asked to come back into the hospital? Let's say if they contract the virus, that they will be asked to come back into a hospital setting earlier than you all think it's safe to be there?
Well, yes. So if you look at the scale that the CDC used, in particular with regard to healthcare professionals, they have 3 standards. You have conventional, contingent, and crisis. When you look at contingent, which is the second level, what they're saying is nurses can come back to work within 5 days, whether they are asymptomatic or still have mild symptoms. So I really am concerned about putting a tool, if you will, in the hands of employers to say you can come back to work even though you're still showing some symptoms, mild as you may think they be. That we could compel nurses to come back to work during this time. We have a little bit of a unholy matrimony, if you will, of looking at health and safety while also having to deal with some of the economic fallout that we have in the broader society, as well as a challenging shortage of nurses or the staffing shortages that we have in our facilities today.
Well, we're so grateful for what the nurses do, the people you represent do. And Sara, I would say the same about you. I was on a plane last week, and I know there have been a lot of incidents in the skies, but I found people sort of going out of their way to thank the flight attendants, because we know how hard the job is always, but especially right now. So what are your concerns for the people you represent up in the skies about these new guidelines?
We expressed concerns because this policy came out on the backs of Delta Airlines lobbying for this, and because of staffing shortages. So it was very clear that this was about trying to push people back to work. And sure enough, since these guidelines have come out, Delta has released its policy. They're cutting the time that they're supporting people with sick leave pay in half. They are not including the asymptomatic guidelines that CDC even had. They're saying people have to come back at 5 days. If they're still symptomatic, they can stay out another 2 days with pay, but that's it. And so this is really about keeping corporate America going rather than focusing on public health, and the evidence is showing that. So we're very concerned. We're not here to talk about what the science is or how many days are the right number of days. We're very concerned that we're putting tools in the hands of employers who are going to abuse this and force people to come back to work before they're better. And when that happens, that is going to increase the conflict on our plane. That is going to make everyone else uneasy. And at 90% likelihood of not being infectious, that means there's 10% likelihood that you are, which means that there will be more infections and we'll have a longer-term pain here.
Hey, Sara, good morning. It's Jonathan Lemire. You just mentioned it, the idea of rising incidents of violence and unruly behavior from passengers on planes. It feels like nearly every day we're looking at some viral clip that's an extraordinarily depressing display of humanity, frankly. So give me a sense of, if you will, just the state of morale of people in your industry right now, your coworkers, your colleagues. How are they doing? How are they holding up? And what additional strain is about to be placed upon them?
Well, they're worn out. They're really tired, and it is very difficult to come to work. And as we said before the holiday season started, they are not picking up voluntary overtime at the rate that they were pre-pandemic, and airlines had counted on that. That's why we've seen some staffing shortages, because people are just not picking up that time because they're so worn out. When we have public trust in health officials eroded because you have them responding, so it seems, to corporate America rather than putting forward good public health policies. That also makes our jobs harder on the plane because we're enforcing these rules to keep people safe, like the mask policies. And when people are not believing in what they're hearing from public health officials, that makes it much harder on us, and the conflict rises, and it's more likely that a flight attendant is going to get punched in the face. So we're very aware of that too. This inconsistent messaging has been the problem from the very beginning of the pandemic.
Cheryl, when it comes to your nurses, what do they need? What do they need the public to do? I know getting vaccinated is the #1 thing, but we know that there's a large part of the population that simply will not get vaccinated. A year ago, PPE was the thing that everyone needed. I understand that there's plenty of that now. What can the federal government do at this moment to help your nurses?
Yeah, well, the federal government has put forward some new resources that they're putting into the states and the military to help support hospitals and healthcare systems. That is all good. They're looking at how they can use the Defense Production Act in another or new or better way in order to help provide support. But here's our reality, just like my colleague from the airline said, is we really need the help of the public. We can sit there and say, with everybody knows they have to get vaccinated. Yeah, they have to get vaccinated. Everybody knows that they need to wear masks. And they need to wear their masks up over their nose, I might add. We had that fine young man who was getting tested. Hopefully he only had his mask below his nose because he was getting tested. But we need people to wear masks. We need them to wear them well. We need them to keep themselves safe. And that has been so politicized, unfortunately, that it's challenging. And may I just say, just like our colleagues in the airline industry, people are taking their frustrations and angers out on nurses. They are hitting nurses as well. There is a lot of workplace violence going on. It has got to stop. It is time for this to stop. It is time for us to all grow up, act like the adults that we are, learn, listen, and behave appropriately so we can get to the other side of this pandemic.
Amen to that. Cheryl Peterson, a vice president for the American Nurses Association, and Sara Nelson, president of the Association of Flight Attendants. Thank you for being here, and please pass along to both of your groups our great thanks for all the work they're doing in this difficult time. We appreciate